Hey everyone, and welcome back to the Health Diagnostic Podcast. I'm your host Sophia, and today we're diving into a type of cancer that you might not hear about every day: sarcomas. They're rare, a little mysterious, and honestly kind of under the radar, which is exactly why we're talking about them today. Whether you hear it because you're curious, you know someone going through it, or you're just trying to understand more about the world of health and medicine, you're in the right place. Before I begin, please remember that I am not providing any medical advice. This podcast is used to spread awareness and should not be used as a diagnosis tool. Please consult your doctor before making any lifestyle changes. As you learn about sarcomas today, it is important to be aware that July is Sarcoma Awareness Month, dedicated to raising awareness about sarcomas, a rare type of cancer that develops in the connective tissues of the body, including bones and soft tissues like muscle, fat, and blood vessels. What even is a sarcoma? Let's start with the basics. A sarcoma is a rare type of cancer, and unlike the more common types that start in organs like the breast, lungs, or colon, sarcomas begin in bones and connective tissues. That means things like fat, muscle, blood vessel, nerves, and the tissue around bones and joints can all be affected. There are two main categories: soft tissue sarcomas and bone sarcomas. Soft tissue sarcomas, which are found most in the arms, legs, chest, or abdomen, and can occur in both children and adults. Bone sarcomas, which, as you'd guess, start in the bones. These are more common in kids and teens. And like many cancers, sarcomas can show up differently depending on where they are in the body. It is also important to discuss the prevalence of sarcomas. Although they are rare, there were still 17,290 cases of bone and soft tissue sarcomas reported this year in the U.S. alone. As stated before, about 13,520 new soft tissue sarcomas will be diagnosed, 7,600 in males and 5,920 in females. Bone sarcomas are a little more rare, meaning that according to the American Cancer Society, there are approximately 3,970 new cases of bone cancers diagnosed each year in the United States. This represents about 0.2% of all new cancer cases. So how do you know if something's off? Let's learn about some signs and symptoms. Early on, soft tissue sarcomas may not cause any symptoms. Sometimes it's just a painless lump or swelling, but as they grow, they can press on nearby nerves or organs, and that's when you might notice pain or tenderness, a feeling of fullness in the abdomen, and breathing issues if it's near the lungs. Signs or symptoms of soft tissue sarcoma can vary depending on where the tumor starts in the body. For example, in the arm, leg, trunk of the body, or the head and neck area, a patient might experience a lump of swelling and tenderness or pain. In the abdomen, a patient might experience a feeling of fullness, pain in the abdomen or back, and in the GI tract, a patient might experience nausea and vomiting, diarrhea, constipation, blood in the stool, and pain in the abdomen. There can also be unusual bleeding, skin changes, or swelling in the limbs if lymph fluid builds up. This is called lymphedema. Now when it comes to bone sarcomas, the symptoms shift a bit. These can include pain or swelling in an arm or leg, the trunk, the pelvis, or the back, and the swelling may or may not feel warm to the touch. A limited range of motion in the joint, a fever of unknown origin, and a bone that breaks from no apparent cause. So yeah, this isn't just your typical I slept funny kind of pain. If something feels weird and doesn't go away, it's worth checking out. But what causes sarcomas? Here's the frustrating part. We don't know exactly why sarcomas happen. What we do know is that they start when cells in bones or connective tissues begin to grow out of control. Normally, your DNA tells your cells when to grow, divide, and when to die. But with sarcomas, something changes. The DNA basically forgets to hit the brakes, and the cells keep growing and dividing when they shouldn't. Sometimes these cancer cells form a mass, aka a tumor. That tumor can grow, invade healthy tissue, and in some cases, spread to other parts of the body, a process called metastasis. We do, however, know a few things that raise the risk of getting a sarcoma. Inherited genetic conditions like Lee-Frattwise syndrome, familial retinoblastoma, or neurofibromatosis, radiation therapy for other cancers, especially when given in childhood. This will coincide with the excess exposure to radiation, lymphedema, which would increase the risk of angiosarcoma, and certain viruses like human herpes virus 8 and people with weakened immune systems. Factors such as old age could also increase a person's chances. So diagnosis, how do doctors find it? Okay, so let's say a doctor suspects a sarcoma. What happens next? First up, they'll go over your medical and family history and do a physical exam. Then come the imaging tests. These are important for reasons such as to look at suspicious areas that might be cancer, to see if and how far cancer is spread, and to determine if treatment is working. Imaging tests would include CT scans, MRIs, ultrasounds, PET scans, biopsies, and plain X-rays. In order to understand why these tests are given, it is crucial to understand what they are looking for and how they work. A plain X-ray could be the first one given. A regular X-ray of the area with a lump may be the first test ordered. A chest X-ray may be done after you are diagnosed to see if the sarcoma has spread to the lungs. CT scans, which stand for computed tomography scans, use X-rays to make detailed cross-sectional images of your body. This test is often done if your doctor suspects a soft tissue sarcoma in the chest, abdomen, or the back of the abdomen. This test is also used to see if the sarcoma has spread to the lungs, liver, or other organs. CT scans might be used to guide a biopsy needle into a tumor inside the body, the chest, or the abdomen, for example. This is called a CT-guided needle biopsy. An MRI, which stands for magnetic resonance imaging, uses radio waves and strong magnets instead of X-rays to take pictures of the body. MRI scans are often part of the workup of any tumor that could be a sarcoma. They're often better than CT scans in evaluating sarcomas in the arms or legs. MRIs help to show where the tumor is, the size of it, and more. An ultrasound uses waves and their echoes to produce pictures of parts of the body. A small instrument called a transducer sends out sound waves and picks up the echoes as they bounce off the organs. A computer then converts the echoes into an image on a screen. An ultrasound may be done before a biopsy to see if a lump is a cyst, meaning if it has fluid in it and is likely not cancer, or if it's solid and more likely a tumor. This test is often not needed if a CT or MRI was done. A PET scan, which stands for position emission tomography, scans use a form of radioactive sugar that's put into the blood. Because cancers use glucose or sugar at a higher rate than normal tissues, the radioactivity collects in the cancer. A scanner can then spot the radioactive deposits. A PET scan is useful when your doctor thinks the cancer has spread but doesn't know where. It can be used instead of many different X-rays because it scans your whole body. Often the PET scan is used with a CT scan called the PET-CT scan. This helps decide if the changes seen on the CT scan are cancer or something else. PET isn't often used for sarcoma but can be helpful in some cases. Lastly, a biopsy. If a soft tissue sarcoma is suspected based on exams and imaging tests, a biopsy is needed to know for sure that it's a sarcoma and not another type of cancer or benign, not cancer disease. In a biopsy, the doctor takes out a small piece of the tumor using a fine needle based on the size and location of the tumor. This tissue is looked at under a microscope and other lab tests may be done. Are you kidding me? So what happens after diagnosis? Let's talk about treatment. The plan depends a lot on where the tumor is, how big it is, and whether it's spread. Here's a quick breakdown of soft tissue sarcoma by stage. So stage 1 is early, slow-growing tumors. They're low-grade tumors of any size. They're small, less than 5 centimeters, or about 2 inches across. Tumors of the arms or legs may be treated with surgery alone. Goal of the surgery is to remove the tumor with some of the normal tissue around it. If cancer cells are found in or near the tissue removed, called positive or closed margins, it would mean that some cancer was left behind. Best choice for closed margin is more surgery or radiation therapy. If the tumor is not in a limb, head, neck, or abdomen, it can be harder to take out the entire tumor and enough normal tissue around. For these tumors, radiation with or without chemotherapy might be given before surgery. This may shrink the tumor enough to remove it entirely with surgery. If radiation is not used before surgery, it will be used after to reduce the chance that the tumor will come back. Stages 2 and 3 are more aggressive tumors. They are high-grade tumors and they tend to grow and spread quickly. Some stage 3 tumors have already spread to nearby lymph nodes. If they have not yet spread, the risk of them spreading is very high. These tumors also tend to grow back in the same area after they're removed. This is called local recurrence. For all stage 2 and 3 sarcoma, removing the tumor with surgery is the main treatment. Lymph nodes will also be removed if they contain cancer. Radiation may be given after surgery. If the tumor is large or in a place that would make the surgery difficult, not in lymph nodes, the patient would be treated with chemo, radiation, or both before surgery. The goal of the treatment is to shrink the tumor, making it easier to remove. In rare cases, amputation might be needed to remove the entire tumor, although this is now done much less often than it was in the past. Stage 4, the cancer has usually spread and to distant parts of the body and is rarely curable. Stage 4 is only curable if the main tumor and all of the areas of cancer spread, metastasis, can be removed by surgery. That success rate was when it spread only to the lungs. Variation of chemo, drugs, and radiation therapy is used. Now, bone sarcomas are a bit different. They're less common and way more specialized. Treatment often involves a team. An orthopedic surgeon is a doctor who uses surgery to treat a bone and joint problems. Often this is an orthopedic oncologist, an orthopedic surgeon who specializes in treating cancer of the bones and joints. A radiation oncologist, a doctor who uses radiation to treat cancer. A medical oncologist, a doctor who uses chemotherapy and other medicines to treat cancer. And a physiatrist, a doctor specializing in rehabilitation and physical therapy. So it's a full-on team effort. Alright, we've covered the medical stuff, but what about the emotional toll? Let's be real, sarcoma can be life-altering. The physical symptoms can drain your energy, and treatments like chemo can be tough, with side effects like nausea, hair loss from chemotherapy, and fatigue. And after treatment, even if you're in remission, the emotional side doesn't always go away. It's totally normal to feel anxious, depressed, or worried about recurrence. Some people find it helpful to join support groups or talk to others who've been through it. Mental health support is just as important as medical care. So that's sarcomas in a nutshell. Rare, tricky to diagnose, and challenging to treat, but not without hope. Early detection, specialized care, and a strong support system can make a huge difference. Thanks for hanging out with me today. If you learned something new, consider sharing this episode with a friend, or just take a moment to be grateful for all the incredible things your body does for you every day. If you have questions, thoughts, or episode ideas, hit me up on socials or wherever you listen to your podcasts. Thank you for tuning in to episode 4. Don't forget to subscribe for more episodes and follow us on Instagram at the Health Diagnostic Podcast. I'll see you next time when I dive into Group B strep. From symptoms to solutions, this has been the Health Diagnostic. Until next time, stay well, stay informed, and stay empowered.